Good morning. Welcome to another segment of Ask the Doctor. And of course, Dr. Nadia Astwood, our Director of Health Services here in the Turks and Caicos, has taken time away again this morning to be with us. Dr. Astwood, good morning.
Good morning, and thank you for having me again.
Thank you so much for joining us. Now, Dr. Astwood, there's still a lot of questions out in the public, so we want to start with one that came from our listeners, and there's still a lot that the public is unsure of. For instance, can persons still access the government clinics while we're observing this lockdown?
Well, the answer is yes. The government clinics throughout the islands are still open. We are operating with reduced hours, especially on the family islands. This is to allow the public health team to go and do their surveillance activities, their contact tracing. But we've also reduced the hours in order to reduce the crowding that we experience in the waiting rooms, because we want to ensure that any patients that come have the relevant social distancing in place. So whereas before, you'd see crowds of people maybe waiting in the waiting area, we're trying to thin that out a bit, but also continue providing services. What people can do, and we put out the numbers for the clinics for persons wishing to go. We also have mechanisms for persons wishing to refill their prescriptions. And then also, we still encourage anyone that's appearing, that has flu-like symptoms or cough, shortness of breath and fever to call our two hotline numbers, which are 232-9444 or 333-0911. And for these persons, we encourage them not to come to the clinics because we don't want them to be in contact with anybody else. Our public health team is able to visit them at their home and, if necessary, take swabs for testing for COVID if it's necessary. Also, on the island of Providenciales, we have the mobile clinic in use. And so we have a schedule which we usually publish. And that goes out into the communities to try and maintain some of our essential programs, such as immunization, because we don't want some of our key programs to fall by the wayside. The immunization program is key to preventing vaccine-preventable diseases in children. So we maintain our core services while at the same time ensuring that the staff have sufficient time to do all of their contact tracing and other public health duties.
Dr. Astwood, is the same true for dental clinics?
Yes, for the dental clinics, because in the islands of Provo and Grand Turk, of course, our dental clinics are located within the hospitals. So persons can call us on 338-5133 or 4 Providenciales. For Grand Turk, they can call 338-3483 or 4. We encourage people only to come if they have dental emergencies, and they will be given an appointment. When they arrive, you know that there are tents at the entrance to the emergency departments in both Grand Turk and Provo. They will be screened for any symptoms of cough, shortness of breath, or fever before they can come into the hospital, and then they will be given treatment. And so the emergencies that we cover during this time, including swelling and dental abscesses or infections, which may require medication such as antibiotics and painkillers. Any kind of dental trauma, damage to the teeth, any uncontrolled bleeding, severe dental pain, painful restorations, dry sockets or infections, as well as any broken teeth. So these are the services that we're focusing on. We're not doing our regular routine services such as cleanings because, there's a risk with all of these procedures. And also we want to ensure that we don't have high volumes of persons coming through the hospitals.
Okay. Dr. Astwood, we know that we have quite an elderly society, and some of them are quite active. I can remember growing up, my grandmother loving to walk to the post office to collect mail. What can you suggest to our elderly to stay active at home?
Well, to stay active at home, there are lots of things depending on how technologically savvy you are. There are a lot of free workouts online. There are some channels that are devoted to workout. We still have the hours where persons can go take activity in the mornings and the afternoons, so they can go for a walk within their community. Make sure that you are, adhering to social distancing to protect yourselves. You can also, just walk around the house, get up, whenever you find yourself sitting down, take a break, get up, stand up, walk around. You can do little exercises, use household products as weights to try and, keep your muscles going and everything. So there are lots of different options, walking around your yard, if you're interested in gardening, etc. But it's really important to take that time. And it's also good, to give yourself some mental clarity as well to, keep physically active and not to just, sit down too much.
Yeah. There's also been a lot of questions about the dashboard. And I know we mentioned it in one of our earlier segments, but tell us a bit more about the dashboard, because persons have been concerned about the stats. For instance, in a 24-hour period a few days ago, Saturday, there were 7 suspected cases, and Sunday, that number dropped to 2. Are these sudden changes due to the receipt of test results, to timing, perhaps?
Yes, I mean, once for all persons that meet the case definition for a suspected case are tested. And so once we receive a test result, either it will be negative or positive for COVID. If it's negative, that person will be removed from the suspected list. And also their contacts, their household contacts, will be removed from the quarantine list. Right. So if the result is positive, then the suspect cases would reduce, and then you would see that increase in the positive cases. So the results of the testing, affect the number of persons reported on the dashboard, as well as if persons have done their 14 days of quarantine and they've remained asymptomatic, they will also be removed from the list.
Okay, great. And also, we wanted, again, a definition of active cases as it relates to COVID-19.
So these are persons who would not have received the 2 negative results at the end of their 14-day period. So these are the persons who are still in active isolation. You will see that the number of positive cases does not reduce. This is the international best practice. So even if a person is recovered, you will still have the same number of confirmed cases. So active cases are the ones that are still either symptomatic or still have the virus and are carrying it. And then once they have received the 2 negative results at the end of the 14-day period, they will then be moved to recovered.
Okay. So when will the public health laboratory start testing for COVID-19?
Well, as you would be aware, we received some of the equipment. It takes more than the piece of equipment to commence testing. We have some additional supplies and materials which we expect to come in country in the next 2 weeks. And once we receive that equipment, we will have to validate it to make sure the results are accurate. So we'll do a number of test runs on it. We also have the virtual training for our staff to use this, because this is a new technology which is being introduced for the first time in the TCI. And so we estimate within the next 2 to 3 weeks, we're going as fast as we possibly can, bearing in mind the challenges that we've had with the global supply chain, to introduce the testing.
Try as best as you can to put it in layman's terms for us. What's the difference between an antibody and an antigen test as it relates to COVID-19?
So an antibody test doesn't actually look for the actual virus. It looks at the response. So anytime you have an infection, you generate antibodies which are used to fight the infection. And so normally it takes about 5 to 7 days for the body to respond. And until that time, the results of any antibody testing is likely to be negative. Now, antibody tests are not used for diagnostic purposes, but in the case of COVID, it might tell you how widely spread the virus is in the population. The problem with antibody testing is that, a lot of the tests that are available are not very accurate, and they're not very consistent. And inaccurate results can have very adverse consequences. So a false positive antibody test could lead to someone thinking, okay, well, I'm immune to the virus, and then that would change their behavior. So we want to make sure that any antibody testing is sufficiently accurate before it's implemented here in the TCI. Now, antigen tests, the antibody tests are usually a blood test. You also have antigen tests, which look for viruses or bacteria. They use either the swabs or the blood tests. and they look for a specific protein in the blood. Now, currently, or the viral swabs. So currently, there are no reliable antigen tests on the market, but a lot of research is being done in this area. Antigen and antibody tests do not replace PCR tests, and that's the polymerase chain reaction tests, which are the most reliable tests, and that's the one that we are hoping to implement in the TCI very soon. And so for antigen tests, about half of the tests might miss infections. So, right now the tests aren't able to provide sufficiently accurate results for them to be used in a widespread manner.
So the ministry is going to be using the PCR testing?
Yes, this is the polymerase chain reaction test. Mm-hmm. It'll be the first time that we have a PCR machine in the TCI, and it is a test which is able to diagnose the active infection, and it looks for parts of the virus during the early stages of the infection. And that would allow us to say definitively if the person has the virus or they don't have it.
Okay, let's switch a little bit to talk about blood donations. We know that that's always a critical area for us, and we encourage people to donate as often as possible and medically safe. But persons appear to be fearful to donate blood in the light of COVID-19. Should they be fearful? And if they should be, why are they afraid?
Well, I think it's a difficult time that the world is facing. There's a lot of unknown surrounding coronavirus. But what I would say is that, blood donation is so critical for any healthcare system. You can't overstate the fact that blood donation saves lives. And there's any number of reasons that persons might require blood, and the blood could save somebody's life, whether it's your own, your family member, or someone you know. So we really, really encourage, at all times for persons to come forward and donate blood, because they really could, make a difference to someone's life. Now, we do have procedures in place, and we have precautions that we take to make donating blood as safe as possible. The blood is collected at both hospitals in the TCI. Persons would have to go through the screening before they enter the hospital. And once they're there, our staff take the necessary precautions to collect the blood. And I really encourage persons not to be discouraged from donating blood. They can contact us to find out any more information. They can use the same hotline numbers or the general inquiry number if they have any concerns. But we still need blood in the TCI, and we are still doing our blood drives because it's critical for us to maintain blood supplies at both hospitals for patients who require it. And we know at this time it's very difficult for us to send patients overseas for treatment. So it's even more critical than pre-COVID times for us to have a sufficient supply of safe blood to transfuse to the general population.
Right. If you're just joining us, you're listening to Ask the Doctor with Dr. Nadia Astwood. Now, Dr. Astwood, we know that you answered this question already for us this morning, but while we're on the air, it just came up again. So I'm going to re-ask the question. We've seen stories in the international press of persons decreasing their dosage in order to make medications last for longer periods. If anyone requires specialized medication, which can only be issued by a doctor, what should they do now?
Well, everyone should closely monitor their supply of medications. And so when they see it getting down to the last week or so of medication, they should contact their healthcare provider, whether it's the private sector or whether it's the government sector. And most places have procedures in place to refill prescriptions to ensure that they don't run out of their medication. And this is particularly important for those persons who have chronic diseases. Although the focus now in the health sector is response to COVID, it doesn't mean that we can take our eye off chronic non-communicable diseases. So this is your high blood pressure, your diabetes, your heart disease, whatever the case may be. It's really important for persons to ensure that they have a consistent supply of medications and that they take it as prescribed. Please contact your healthcare provider and do it in sufficient time that you can get your prescription refilled. The pharmacies are essential services, so there are provisions for them to be open to provide service to the general public. Please take a proactive step to do so earlier. And then hopefully if you're able to get refilled, you can refill from the same prescription the number of times that your healthcare provider writes on it. But I encourage everyone, please, please, please take your medications, take them regularly, take them as prescribed, and, also practice the healthy lifestyle. So in terms of what you're eating, your physical activity, please ensure that you do all of these things, which would help you control your chronic disease better. I mean, certainly, working in public health, myself and all the persons in the Ministry of Health and all of the different departments that work in the Ministry of Health, our prime focus is public health. And what we do and the advice that we give and the recommendations that we make, everything is underpinned by public health. And we want to ensure that what is done is in the best interests of the residents of the TCI in order to keep persons safe as long as possible and to provide them with accurate information for them to take the steps they need to keep themselves and their family members, their communities, their friends safe. And so, all of us, that is our prime focus in every action that we take, every decision that we take, every conversation that we have. That is at the core of everything that we do. And so we take it, incredibly seriously. I am from here. This is my home. Everyone here, you are all my people. And I want the persons and the residents in the TCI to be safe. I want them to be healthy, whether it's COVID, whether it's non-communicable diseases, whatever it is. And it's really about empowering persons to take the correct steps to keep themselves safe. And then also, putting in place the relevant measures to keep the wider public safe. And as well as, really focusing on how to protect the more vulnerable in our community. So if it's a compliment, I'll take it. But, certainly my focus and the focus of everyone in the Ministry of Health. And I must again thank the public health team who are doing an excellent job, working very hard behind the scenes to ensure that services are maintained, as well as ensuring public health. So, really it's a team effort. It's not a one-man show. It's an entire ministry effort. And, with the support of the government and also with the support of other frontline workers who are really there keeping the TCI ticking over and doing everything that they can to keep the TCI safe.
And you said you're going to make the TCI great again, right?
Make the TCI great again, but in particular, Granta. Thank
you. Thank you so much for joining us. As always, we'd like to give you the last minute to appeal to us as a people, as the listening public, about the things you'd really like to see us do and continue to do. So the last minute is yours.
Well, thank you. I think I've become like a broken record, but please, everybody, practice proper hygiene at all times. Anytime you think about it, wash your hands with soap and water for 20 seconds. Cover your cough, cover your sneeze. If you're having cold or flu-like symptoms, cough, shortness of breath, please call our hotline numbers. Stay away from the healthcare facilities, and we will do our endeavor best to support you. If it's really essential, you can go out, but please stay at home. This makes life easier for the frontline workers to do their job, but it also keeps you safe. So please stay at home unless it's really, really essential and you need to access some essential services. And please also look out for your neighbors. If you have elderly neighbors that may need some help or some support, please reach out to them. And also, something that I don't always touch on, please look after your mental health. Do some things to decompress. It's very stressful. But please do some things, maintain your spirituality. Join the virtual churches, and I know all the churches have their different means of keeping communication with their flocks. So please, look after yourself in totality, do your physical activity, have a good diet, a balanced diet, and also just try and look after one another.
Thank you so much, Dr. Astwood. We'll talk to you again on Monday morning. Until then, have a great weekend. Thank you.
Thank you.